Hi, my name is Dr. Arnold, and today I'm going to be helping you as a dental associate consider the things that are important when choosing what courses to go on. Now, after dental school, it's important that you're continually developing. There's continued professional development that you have to do, but also think of the skills that you're going to want to learn in order to bring variety into the treatments that you're offering to your patient. It's what starts to make dentistry exciting, the fact that you can offer different treatments and combine them to produce results that your patients will benefit from. In a perfect world, you would be able to go on whichever course you wanted to go on. But in reality, it can get very expensive. It can quickly become expensive if you're enrolling on a lot of courses. So it's important that you highlight the courses which are going to be most beneficial to you, the stage that you're at, and that you're going to be able to get the most use out of. First point I want to make is to listen to your patients. Your patients are going to come in and they're going to be requesting certain treatments. If you take a note of the common treatments that they're requesting, that will give you a clue as to the type of courses that you should be enrolling on. This will give you an idea of the demand for certain treatments, and then you can match the courses and the skills you develop to that. There's no point doing a course that you can't put to practice. So make sure you're listening to your patients. Also, find out whether your patients are really serious about this treatment that they seem to be requesting. So, for example, if it's implants, are they willing to pay the cost that comes with having implants placed? So, for example, if patients seem to be requesting implants, when you refer them to a dentist who places implants, are those patients actually following through and going to see that dentist? Are they paying for that treatment? So not only what patients are saying, but are they also carrying out your recommendations and having that treatment done? So that will let you know what the true demand is for that treatment, and it puts you in a good place to make a well-informed decision on what courses to go on. Listen to your patients, but also listen to yourself. What are you passionate about? There's no point your patients are demanding implants, but you're not interested in implants. You want to choose something that's going to be of interest to you. Your patients are going to be they're going to sense the excitement, the enthusiasm you have for that treatment. You're going to provide them with good outcomes, good results, and undoubtedly they're going to refer their friends, their colleagues, their family members to you for that same treatment. So there's this cycle that's really going to work well, where you're passionate about a certain treatment that you provide. Your patients sense that, your patients experience that, your patients love the outcome you produce for them. They refer more people. You end up doing more of that treatment. So it's so important to make sure you're picking something that you enjoy. Also, it might just be that you think about the things you don't enjoy. That's a great way of discounting certain courses. If you can think of that treatment that you really don't like doing, you don't like carrying out, that'll also inform you about courses that you might not go on. But don't use that as an excuse to not work on your weaknesses. It might just be that there is a weakness that you need to overcome, so you actually do need to go on that course in order to turn that weakness maybe even into a strength. Listen to reviews. Listen to the feedback. Listen to what your colleagues, what your peers say about that course. does the course deliver? You know, when people go on that course, do they find themselves able to implement the skills learned on day one? If they do the course on a Saturday, can they go into work on a Monday and start implementing the skills that they learned? So make sure you're talking to your peers, to your colleagues, listening to reviews and the feedback that's given about that course. A bonus piece of advice is to pick courses that complement each other. It might be that you enjoy placing implants, and you want to learn how to place implants, and it may be that that goes hand in hand with some oral surgery courses. It may be that, you know, developing your skills in suturing, in extracting teeth is going to serve you quite well with placing implants. So start to think about courses which complement each other, and that way they have a synergistic effect where you're stacking on certain skills and really solidifying, consolidating your confidence and your ability within that certain skill set. It might be that you enjoy orthodontics, so it might be that you carry out courses or go on courses that cover orthodontics, and you go on courses that look at something like composite bonding, anterior composites, posterior composites, and again, that can work quite well for ortho-restorative cases. It also helps in the purchasing of equipment. It means that you can purchase equipment that you're going to be using. It might be that it's a scanner that's brought in, or it might be certain equipment for placing implants. So if you're doing courses which complement each other, then you're not having to get so many different types of equipment to do different treatments. If you're doing courses which complement each other, then it means that the equipment that you get, you'll be using quite regularly, quite frequently, and getting the most use out of them. So pick courses which complement each other and where you can stack skill sets and really blossom as a clinician in that area. For myself, my interest is clearly in orthodontics, if you've watched some of my other videos. So I found myself going on courses like Invisalign, going on courses where I'm learning fixed orthodontics. So course that runs over 1.5 to 2 years. And I've got more orthodontic courses that I'm looking to get involved in. But together with that, I found that patients also are requesting composite bonding, composite veneers, smile makeovers. So I've started to also go on courses which develop my skills in composite bonding, in providing composite veneers, and that complements each other in that I can provide the orthodontic treatment and I can provide the composite veneers that patients are requesting, and that works quite nicely in the flow of the treatment that I'm providing, and I continue to be able to do more and more of that as a result. And that works as well because when I do the courses, I'm instantly able to implement the skills learned in the treatments that I'm providing, the ortho-restorative care that I'm providing for my patients. So that's how that's working for me, and I'm sure if you can find your niche, your lane within dentistry, you can start to see the benefits of choosing your courses wisely. I hope you have enjoyed the video. Make sure to leave a comment, press the like button, subscribe, and I will catch you at the next one.